My Health in Shepparton, a guide to local health services. This booklet outlines health services available in Greater Shepparton with an explanation of specific services for refugees and migrants. This booklet was developed by Goulburn Valley Health's Health Promotion Unit in consultation with Greater Shepparton City Council, Kildonan Uniting Care, Primary Care Connect, Family Care, the Ethnic Council of Shepparton and District, Vision Australia, Red Cross Australia and Goulburn Ovens Institute of TAFE. We would like to acknowledge the support of the R.E. Ross Trust. Glossary. A. Advocate. To speak, plead in favour of another person. After hours refers to services offered to the public before 9 a.m. and after 5 p.m. Allied Health provides services such as physiotherapy, occupational therapy, dietitian, speech pathology, and podiatry. B. Breastfeeding. To nurse, feed a baby at the breast. Breast screen. A test to look for any signs of breast cancer. Bulk billing. Allows for medical bills to be sent directly to Medicare for payment. C. Cervix. Part of the female structure, narrow outer end of the uterus. Clinician. A health professional. Critical. Indicates the severity of a condition. E. Emergency. Life-threatening. F. Fertile. Of childbearing age. G. General practitioner or GP. A medical doctor who is trained to provide primary health care to patients. H. Healthcare. The prevention, treatment and management of illness. Healthcare covers physical and mental well-being. Medical and allied health are both important as part of your healthcare team. L. Laboratory. A room or building where blood samples are sent for testing. Life-threatening. A critical change in your well-being requiring immediate medical attention. Call 000. M. Mammography. X-ray examination of the breasts looking for tumors. See breast screen. Medication. Prescribed medication from your GP to maintain your health. Menopause. No longer fertile. See Women's Health. N. Non-prescription. Medication available from your chemist that does not require a GP prescription. O. Optometrist. A person who looks at the health of the eyes. P. Pap test. A test done to monitor the change in cells in the cervix. See Women's Health. Perinatal. The 5 months before birth and 1 month after birth. Prescription. A written order from your GP for medication to maintain your health. S. Specialist. A member of the healthcare team who is highly skilled and knowledgeable in their specialist area. For example, gynecologist. Symptoms. A physical or mental sign that indicates a disease. T. Treatment. The act, manner or method of handling or dealing with someone or something. Time critical. The outcome of a situation is time-based. Triage. Assessment of your symptoms to determine the priority of your referral and treatment. W. Widowed. A woman or a man whose spouse has died.
No amount of information can give you full comfort or ease in a new country, let alone a new town. Healthcare systems are different throughout the world. There will be many changes to how life may have been before arriving to Shepparton, especially when it comes to your health, and it can be very overwhelming. My Health in Shepparton booklet aims to provide you with information to assist your transition. This booklet is to be used as a quick reference tool to allow you to save time and energy and to focus on important aspects of your life such as family, good health and enjoying your new community. Dial 000 for emergency assistance.
The Australian Charter of Healthcare Rights in Victoria.
The Australian Charter of Healthcare Rights describes the rights of patients and consumers and providers using the healthcare system. These rights are essential to make sure that wherever and whenever healthcare is provided, it is safe and of high quality. All healthcare services in Shepparton follow this charter and acknowledge your rights. These rights are outlined in the Australian Charter of Healthcare Rights in Victoria booklet. These booklets are available at healthcare services and online in 24 different languages, including a Braille version. Go to www.health.vic.gov.au. We recommend that you make yourself familiar with these rights.
Australia's health service system.
Australia's publicly funded healthcare system is called Medicare. The Medicare program looks after the health of Australians through services and payments such as Medicare and the Pharmaceutical Benefit Scheme.
Other programs include the Australian Childhood Immunisation Register and the Australian Organ Donation Register. When registering for Medicare, you will need to present your passport or IMI card as well as an eligibility document such as a visa grant letter from the Department of Immigration and Border Protection or evidence from visa entitlement verification online.
Once you are registered, you will be provided with a Medicare card number, which you can use to access healthcare services immediately.
These include free treatment and accommodation as a public patient in a public hospital, help with the cost of out-of-hospital care and subsidised medicines. You'll be sent a Medicare card with your Medicare number, your name, and the names of other family members if they are registered on the same card.
Medicare helps with the cost of your visits to health professionals such as doctors, specialists, optometrists, and in some circumstances dentists and other allied health professionals.
Some health professionals bulk bill, see the glossary. For bulk bill visits, the health professional will bill Medicare directly and you'll have no out-of-pocket costs. Other health professionals may charge you for services.
If so, talk to your health professional or go to humanservices.gov.au/Medicare for more information about claiming a Medicare benefit. For more information about Medicare, go to humanservices.gov.au/Medicare or visit your local Department of Human Services Centre.
Interpreters.
Everyone has the right to be informed about services, treatment options and costs in a way that they will understand. Accredited interpreters are available to everyone. An interpreter is essential in helping discuss your medical history, treatments, test results and diagnosis during assessment or admission. If your GP or healthcare provider does not speak your language, it is possible for them to arrange an interpreter. When making an appointment, you will need to inform the receptionist that you require an interpreter and the language that you require. An interpreter can be provided on site or over the phone, depending on your preference and the availability of interpreters. This is the healthcare provider's responsibility. You should also inform the receptionist if you require a male or female interpreter. All efforts will be made to accommodate your request. Interpreter services are free of charge for public hospitals and GPs. Charges may apply for private clinics and specialists. It is important to use an interpreter because they can help you communicate with health professionals. Interpreters are especially trained to understand medical language. If you ask a friend or family member to interpret it for you, it might be difficult for you to discuss private or difficult issues, particularly if the person interpreting is a child. Often healthcare services insist that you use a professional interpreter. Translation Interpreting Services, TIS, can provide interpreters. You can call 131 450 to make an appointment or receive immediate interpreting services. Always use accredited interpreters when available.
General practitioners, GP.
A general practitioner, or GP, looks after your general physical and emotional health. They're also called a family doctor or local doctor. Unless you have a health emergency, the best place to go when you're unwell is to your GP. Appointment time can be limited. It is important to make individual appointments for each person. If you and other family members want appointments at the same time, please ask when making the appointment. GPs can talk with you about things you can do to look after your health and to prevent illness, such as immunisation and men's and women's health checks.
Health checks help GPs have a greater understanding of your health. This may involve a physical examination or some tests, for example, blood test or hearing test. During a health check, the GP will ask you about your health and any treatment you have had in the past. Having a GP you're comfortable with will help your GP to get to know you, your medical history, and to monitor your health over time. Asking a family member, friend or healthcare service provider to recommend a GP in your area can make the choice easier.
A concession card or healthcare card can entitle you to cheaper medication, low-cost dental treatment and low-cost glasses. If you feel that your GP has not taken your problem seriously, you have the right to change GPs or make a complaint. Important points to remember. Take your Medicare and concession card to all appointments. Provide your GP with as much information about yourself and how you feel as you can. Your GP is not allowed to discuss your medical information with anyone else other than you and without your permission.
If you're unsure of anything the GP has said, make sure you ask them to explain it clearly or ask for an interpreter. If you are unable to attend an appointment, you should call your GP's office to cancel the appointment as soon as possible.
Shepparton Medical Centres. Archer Street Clinic, 215 Archer Street, Shepparton. Call 5821 7344. Family Medical Centre, 174 Nixon Street, Shepparton. Call 5822 2533. Kyala Medical Clinic, Shop 21D, 8025 Riverside Plaza, Goulburn Valley Highway, Kyala. Call 5823 5446. Lister House Medical Centre, 60 Nixon Street, Shepparton. Call 5831 2333. Marketplace Medical Centre, Shop 31 110 Benalla Road, Shepparton. Call 5822 2677. Nixon Street Medical Centre, 46 Wyndham Street, Shepparton. Call 5822 1000. Princess Park Clinic, 172 Welsford Street, Shepparton. 5821 9655. Sana Medical Centre, 142 Nixon Street, Shepparton. Call 5822 4000. Shepparton Medical Centre, 49 Graham Street, Shepparton. Call 5823 3100. The Old House, 77 Wyndham Street, Shepparton. Call 5831 1366. TriStar Medical Group, 6-8 Waranga Drive, Kyala. Call 5823 5977. Wyndham House Clinic, 96 Maud Street, Shepparton. Call 5821 5633.
Goulburn Valley Health, your local hospital.
Goulburn Valley Health is your local public hospital, located in Graham Street, Shepparton. Goulburn Valley Health provides hospital services for patients needing surgical, medical, paediatric, maternity, intensive care and psychiatric treatment services. It also provides community services such as a diabetes education program, continence and aged care services, allied health and oncology. To access these services, you need a referral from your local GP. Other services available at Goulburn Valley Health include dental, pathology and medical imaging. If your illness or injury is urgent, you must go straight to the emergency department, which is part of your GV Health.
Emergency Department.
The Emergency Department provides urgent health care to people who are seriously ill or injured. In Shepparton, the Emergency Department is part of GV Health, your local hospital located in Graham Street in Shepparton. When you attend the Emergency Department, you can expect that a triage nurse will assess your illness or injury. You will be assigned a triage category according to how severe your illness or injury is. Category 1 patients will be treated immediately, and Category 2 to 5 patients will be asked to wait in the waiting area if appropriate. A clerk will then collect your personal details to help identify you during treatment. Waiting time in the Emergency Department depends on how severe your injury or illness is and the illness or injury of others. Some patients in the Emergency Department are treated and are able to go home. If you need to be admitted to a hospital bed or for further treatment, hospitals aim to transfer you from the Emergency Department to a hospital bed in a timely manner.
Dialing 000.
Dialing 000 if your condition or situation is life-threatening or time-critical. Depending on your emergency, an ambulance, police or fire service will respond to your request. Dialing 000 is free and you can dial it at any time from anywhere. It is very important you remember this number 000 in case of an emergency.
Medical costs.
Your Medicare card provides assistance with eligible cost. There is a gap that is usually paid on the day of appointment. For example, Medicare can help pay for costs of doctors, consultation fees, including specialists, x-rays and pathology tests, eye tests performed by optometrists, treatment and operation in a public hospital. Eligible costs are billed to Medicare directly. Sometimes there is a gap between the costs and what Medicare will pay. This gap amount is usually paid on the day of appointment. If you have a concession card or healthcare card, this can entitle you to cheaper medication, low-cost dental treatment and low-cost glasses.
Medication.
In Australia, there are laws stating which medications can be bought from a chemist without a prescription and medications that must be prescribed by a GP. The pharmacy or chemist is a building where medications are kept and sold. It may be a department in a hospital or a shop in the community. When you are given a prescription from your GP, take it to a chemist. They will tell you how to use the medication and place your name on the bottle or box. It is important to follow the directions and to finish the course of medication. The medication is only for use of the person named on the bottle or box and must not be shared with others. It is against the law to give these medications to others or to send them overseas. A patient in the hospital can receive medication from the hospital pharmacy. If you are given a prescription from a doctor at the hospital, you can get your medication at Goulburn Valley Health's pharmacy or at a community pharmacy. You may be sent to the Goulburn Valley Health Pharmacy for specialised medicines that are not available at a community pharmacy. The community pharmacy or chemist will supply medications that are ordered on a prescription from a GP. Community pharmacies also sell medications that do not require a visit to the doctor. Always keep medication in a safe place and out of reach of children.
What is a community health centre?
A community health centre is a centre which offers a range of health and welfare services. Primary Care Connect is Shepparton's local community health centre located at 399 Wyndham Street, Shepparton. Services. Refugee counsellor advocates can provide emotional support when stress and worry become a problem for you, especially stress from things that occurred before coming to Australia. They can also assist and find other services on your behalf. Refugee health nurse can provide information and assistance on health and welfare issues and help link you with GPs and hospital services. Dietitian can provide advice on diet and nutrition to prevent or manage health problems. The financial management team can assist you if you have financial difficulties, including helping you to develop a budget. There are many other services that Primary Care Connect offers. For more information, please contact 03 5823 3200 or visit www.primarycareconnect.com.au.
Community Health at GV Health is a program offering support to people of all ages with various health conditions and other needs to make positive health behaviour changes. Services include occupational therapy, physiotherapy, dietetics, social work, sexual health services, speech pathology, podiatry and self-management support. There are many other services offered at GV Health. Ask your GP about these services or call Community Health on 1800 222 582. Although many of these services are free, there may be a small fee for some services. If you're unable to pay, please discuss this with your clinician.
Aged care.
In Australia, people of all ages are valued. Aged care is the care of the elderly. In Shepparton, there are many services that can assist with the special needs and requirements that are unique to the elderly. For more information of these services, please ask your GP or contact your local council on 1800 200 422 or visit www.myagecare.gov.au.
Women's health.
In Australia, there are services and programs to help women care for their health. In Shepparton, the following services and programs are available. Planning your family and your reproductive health. If you would like information or advice about spacing your pregnancies or other women's health issues, you can consult with your general practitioner. Your GP is able to provide you with a referral to visit. Welcome to Rosewood. Women's Health Centre Rosewood at Goulburn Valley Health is part of the Specialist Consulting Suites. It's located on Graham Street and Building M. Telephone 03 5832 3600. The Pap test helps to find changes in the cells in the cervix. If the changes are found early, before symptoms have an opportunity to show, then they can be easily treated. If they are not found early, then they may become cancer of the cervix. A GP or specially trained nurse takes a cell sample from the surface of the cervix or neck of the womb. This may be a little uncomfortable but should not hurt. The sample is then sent to a specialist laboratory to see if there are any changes in those cells. Women are encouraged to have a Pap test every 2 years after their first sexual contact or from the age of 18 years, whichever is the oldest. Women are encouraged to have a Pap test every 2 years. Any woman who has ever been sexually active should keep having Pap tests until the age of 70, even if they are widowed, divorced or past menopause or no longer sexually active. There is no charge for a Pap test, but some GPs might charge for the consultation. You can ask before you make an appointment. Some women feel uncomfortable or embarrassed about having a Pap test, so it is important that you choose a health professional you feel comfortable with. You may prefer a female GP or nurse. Pap tests are available from your GP and also the Women's Health Service at Goulburn Valley Health.
Breast X-ray screening, also called a mammogram, is provided free of charge through Breast Screen Victoria. A breast X-ray is a test to detect breast cancer in its early stages before it can be felt by you or your GP. There is a better chance of successful treatment and recovery if breast cancer is detected early. Breast cancer becomes more common in women as they get older. If you are over 50 and have no breast symptoms, you should have a breast x-ray with breast screen every 2 years. Most women who have the test are pleased to find that they have no signs of cancer. For an appointment, phone 132 050. If you have breast symptoms, a lump, swelling or painful breasts, it's important that you see your GP.
Maternal and Child Health Services.
Maternal and Child Health Centres are staffed by specially trained nurses who provide growth, health and development checks for children, support to parents on feeding, behaviour and other childcare matters, information about women's health issues, counselling and referral for postnatal depression, groups to meet with other parents and children, immunisation programs, home visiting service if it is difficult for you to get to the centre, referral to other children's specialist service, for example dietitian, speech therapist. This is a free service for families with children aged 0 to 6 years. Ask your local government council where to find a maternal and child health centre close to you or call 5832 9312. Perinatal emotional health nurses are available for support at GV Health.
Why is immunisation important?
Immunisation is a safe and effective way of protecting you and your family against a wide range of diseases, such as measles, before you come into contact with them in the community. Immunisation is not compulsory, but it is highly recommended for everyone. Immunisation may have been given in your home country, however, it is strongly recommended that you have a check with your GP or maternal and child health nurse to see whether you have been immunised against all the diseases covered by the immunisation program in Australia. It is a good idea for both adults and children to have this check.
Where can I go for immunisation?
A free immunisation program against a range of diseases is available for children and adults. There may be a charge for some immunisations. Sessions for children 0 to 6 years are regularly held by local councils. Ask your local government council or your maternal and child health centre for the location of immunisation clinics and session times. Infants, school-aged children and adults can also be immunised at their local GP clinic or council immunisation session. If you have any questions about immunisation, discuss them with your family GP or maternal and child health nurse.
Breastfeeding.
Breast milk is a normal food for babies, perfectly designed by nature for human infants. It is a complete food containing all of your baby's nutritional needs for the first 6 months of life. It satisfies both hunger and thirst. Extra water is not needed. It increases a baby's resistance to infection and disease. It lessens the risk of allergy and food intolerance. Breastfeeding is important for mothers too. It's convenient, cheap, and always there when you need it. It's always fresh, clean, and safe. It quickly soothes a fussy, unhappy baby. It helps your uterus return to normal sooner after childbirth. It gives you a chance to sit down during the day and rest as you breastfeed. Mothers who don't breastfeed have increased risks of cancer of the breast and ovaries, heart disease and osteoporosis. Breastfeeding helps create a close and loving bond between you and your baby and can be a deeply satisfying experience for you both.
Local support for breastfeeding mothers. GV Health Lactation Unit, Graham Street, Shepparton. Call 5831 1370. Maternal and Health Child Nurse. Contact your local council on 5832 9312. Greater Shepparton Breastfeeding Cafe. Community Centre, Riverside Plaza, Shop 21C, Goulburn Valley Highway, Kyalla, or call 5832 9312. Australian Breastfeeding Association Shepparton Group, 24-hour helpline 1800 686 268 or email abashepparton@gmail.com or visit www.facebook.com/abashepparton. Family Care Parent Child Program. Call 5823 7000.
Dental care.
Where can I go for dental care? You can seek professional dental care through private dentists or public dental clinics. Private dentists do not have long waiting lists, but can be expensive.
What if I can't afford a private dentist?
If you have a healthcare card or a pensioner concession card, the state government provides limited dental care for a small fee at GV Health Dental Services, Graham Street in Shepparton. Depending on the treatment provided, other costs may be incurred at a subsidized rate up to a maximum of $104. A dental emergency usually means either a toothache, swelling around teeth, in the mouth or face, or bleeding.
Eye care. Where can I get my eyes tested?
You can go to an optometrist for an eye test. You do not need a referral from your GP. It is normally recommended that you have an eye test every 2 years. Most optometrists bulk bill examination costs to Medicare, so you do not have to pay anything for the consultation. However, you do have to pay for glasses and contact lenses. If you have a pensioner card or healthcare card, or you're a full-time student, you may be eligible for low-cost eye care, including cheaper glasses and contact lenses, through the clinics of the Victorian College of Optometry.
What if glasses don't help?
Vision Australia is an organisation that provides services to people who are blind or have low vision. Its services are aimed at helping people to be able to do the things they need and want to do.
Services.
Low vision clinics provide assessment and training to help people better understand their vision condition and make the most of their remaining sight, for example through the use of a magnifier and improved lighting. Advice and training in daily activities such as cooking, using appliances and personal care. Assessment and advice on aids to help people to continue to read, manage daily tasks and enjoy recreational activities. Training in orientation and mobility skills to help people to walk around and travel safely and confidently. Advice and training in technology to enable people to use a computer or other devices. A library offering talking books and magazines. For more information about these and the many other services that Vision Australia provides, please phone 5831 9400 or 1300 847466 or visit www.visionaustralia.org.
Hearing care.
An audiologist evaluates, diagnoses, treats and manages hearing loss in individuals of all ages. GV Health Audiology is found in the Hub. GV Health Audiology services include newborn diagnostic assessments and family support for babies referred by the Victorian Infant Hearing Screening Program and general diagnostic assessment for children and adults. Hearing services for children under the age of 18 are free.
Where can I get my hearing tested? Goulburn Valley Health Audiology. Free hearing services are provided to children under 18. Adults make a small co-payment depending on income. You can access through obtaining a referral from your maternal health and child health nurse or family GP, ear, nose and throat specialist or other medical practitioners or speech pathologists. Call 5821-6600 to make an appointment. Commonwealth Office of Hearing Services. People who have a pension, concession card can access. People who receive sickness benefit from Centrelink. This service is not available for healthcare card holders. You will need to obtain an application form from your family GP or Office of Hearing Services website at www.hearingservices.com.au. A list of approved providers for your area can be found on the website. Any approved service provider can also assist with your application. Australian Hearing. Free hearing services are provided to hearing impaired children and young adults up to the age of 26 who are permanent residents of Australia. Call 131 797 for locations. HEAR service. Free preliminary hearing tests are provided to adults, available at some community health centres in Melbourne.
Private audiology practices generally offer hearing aid services and advice, which can be free for pensioners and Department of Veterans Affairs Gold Card holders if the audiology practice is an approved service provider for the Office of Hearing Services.
Support in Shepparton.
Well-being and emotional health.
We know that people migrating to Australia can have reactions after arriving, such as trouble concentrating, sleeping difficulties, nightmares, and feelings of guilt and sadness. These may be quite disturbing, particularly when you're trying to settle into Australia. If these reactions interfere with your day-to-day life, it can be helpful to talk about them with a counsellor, social worker, or psychologist who can discuss and plan ways of overcoming them. To access support, you can contact Primary Care Connect on 5823 3220 or ask your GP to help find a service.
Headspace Shepparton offers services to young people from ages 12 to 25. If you feel down or stressed about anything, call 03 5823 8800 or visit headspace.org.au.
Refugee and asylum seeker support.
Most new arrivals have a caseworker who is able to assist with settling in Australia. Depending on your visa or asylum seeker status, they can assist with housing, arranging English classes, enrolling children in school, Centrelink forms, getting furniture and other necessities for your home, finding childcare and making new social connections. The following organisations in Shepparton dedicate their time, expertise and efforts to individuals and families who require any of their services. Kildonan Uniting Care at 219 to 225 Wyndham Street, Shepparton. Telephone 5831 6157. Ethnic Council of Shepparton and District at 158 Wellsford Street, Shepparton. Telephone 5831 2395. Red Cross at 399 Wyndham Street, Shepparton. Telephone 1800 811 700. GoTafe at 152 to 200 Friar Street, Shepparton. Telephone 1300 468 233.
Disability support.
Disabilities can be physical, intellectual, psychiatric or behavioural, hearing or vision impairment, an acquired brain injury or development delay. In Shepparton, many community-based organisations can provide direct care and support for people with disabilities. If you are diagnosed with a disability, Centrelink can provide financial benefits for you and your carer. Support for people from a non-English speaking background who have a disability and their carers is available at Family Care at 19 Wellsford Street, Shepparton, Primary Care Connect located at 399 Wyndham Street, Shepparton, Connect GV at 12 Bowenhall Street, Shepparton, Vision Australia, who are located on the corner of Archer Street and Channel Road in Shepparton.
Getting connected in Shepparton.
The Greater Shepparton City Council has a lot to offer the local community. For information about local activities, events and sports clubs, visit www.greatershepparton.com.au or give us a call on 5832 9700. A list of local agencies in Shepparton is located at the back of this book. Each can assist you with your individual needs. In partnership, we're able to give the best services to help your new life in Shepparton be safe and pleasant.
Contact us. GV Health, Graham Street, Shepparton. Call 5832 2322. Ethnic Council Shepparton, 158 Welsford Street, Shepparton. Call 5831 2395. Family Care, 19 Welsford Street, Shepparton. Call 5823 7000. Go TAFE, 152 to 200 Friar Street, Shepparton. Call 5833 2686. Greater Shepparton City Council, 90 Welsford Street, Shepparton. Call 5832 9700. Primary Care Connect, 399 Wyndham Street, Shepparton. Call 5823 3200. Kildonan Uniting Care, 219 to 225 Wyndham Street, Shepparton. Call 5831 6157. Vision Australia, corner of Archer Street and Channel Road, Shepparton. Call 5831 9400. Red Cross Australia, 399 Wyndham Street, Shepparton. Call 5823 3268. Headspace, 129 High Street, Shepparton. Call 5823 8800. Dial 000 if your condition or situation is life-threatening or time-critical.